The Health Legacy Project from 2016 to 2020
is a £2.9 million project funded by the Ellis-Hadwin Legacy. The project is an innovative project designed and implemented to test Christian aid adaptive and integrated program approach in resource-limited and fragile settings. The Strand 1 countries, Burundi, Sierra Leone and South Sudan, tested the viability of Christian aid community health framework in conflict and resource-poor setting. The Strand 2 countries, Nigeria, Kenya and Burundi, strengthened program integration across different health teams to achieve greater impact, while the Strand 3 contributed to credibility of our health program through research and evidence-based learning. The project built strong partnership through community-driven intervention that informed the needs, priorities of target communities using participatory, vulnerability and capacity assessment tools, PVCA. The tool helps to identify frequent outbreaks of diseases in South Sudan, poor maternal reproductive health, hygiene issues, and poor decision-making power by women in Sierra Leone, as well as malnutrition among children and lactating mothers, amongst other risks, were identified in Burundi. To achieve deep and lasting change, the project built on Christian Aid's gender and social inclusion approach across the 5 countries. The project strengthened community accountability mechanisms to advocate for rights to essential services and inclusion of vulnerable groups in decision-making processes. Gender model families approach was used to shift community dynamics by challenging traditional notions of gender roles and responsibilities. In Sierra Leone, men now have improved gender attitudes to traditional female roles, an improvement from 2018, when many did not get involved with household chores and shared responsibilities. Also, 80% of health workers residing within the 22 project communities testified of men's support to their wives in clinic attendance and access to health facilities. Evidence-based learning approach improved project outcomes through strategy testing and learning workshops to provide robust data for analysis to determine the extent to which strategy is delivering on objectives. Also, evidence generated from learning activities across the countries improved understanding of project context, effectiveness of Christian aid adaptive programming approach, and the overall impact of the project. In Burundi, the Tubakuzi project, Support Them to Grow, improved nutritional outcomes for under 5, pregnant and lactating women, and hygiene of people living with HIV. The project worked through local partners to bridge gender gap in agricultural production through women VSLA groups, which ensured women's voice in decision-making and income generation. The project supported women's economic empowerment and power to make decisions related to health and nutrition. In Sierra Leone, the project strengthened the capacity of communities and health systems to be resilient, equitable, inclusive, and responsive to the need of vulnerable and marginalized groups by improving maternal and newborn health and adolescent sexual and reproductive health. The district health sector budget increased by 52% due to targeted advocacy at local levels. In South Sudan, the project worked to improve disease surveillance while addressing gender-based violence and resiliency of local communities. Communities developed good hygiene practices and constructed 16 household latrines and 2 public latrines. The project supported 63 women members of 3 self-help groups to have better access and control over resources. Reported cases of gender-based violence to the chief's courts and the police station increased during implementation. In Kenya, the project improved the nutritional status of adolescent mothers and their children, 0 to 2 years, by promoting nutritional practices amongst adolescent girls and sexual and reproductive health rights in Narok County with high prevalence of teenage pregnancy at 40%, according to KDHS 2014. The project incorporated school-based life skills education for the prevention of teenage pregnancy and diseases by improving positive attitudes, values, and skill sets for making informed and healthy decisions about their sexual lives. In Nigeria, The project used innovative and evidence-based approach to strengthen integration of nutrition services into existing DFID-funded community case management of childhood illnesses, which contributed to reduction of under-5 mortality in hard-to-reach communities. The project increased coverage and delivery of nutrition services under ready-to-use therapeutic foods, RUTF, and other supplementary foods at health facilities and built capacities of health workers. The Health Legacy Project experience has shown that multi-stakeholder collaboration ensures long-lasting impacts of projects. Hence, further intervention should prioritize partnerships with all stakeholders, accountability mechanisms, and program integration to achieve deep and lasting change.